Mary, this is Juliet. Today I am going to present and explain to you about cardiovascular diseases. I hope I can help you understand each of the cardiovascular condition. Cardiovascular diseases are the conditions that affect the structures or functions of your heart. It is the leading cause of death in the US, and there are several cardiovascular diseases such as angina pectoris, heart failure, endocarditis, heart attack, hypertension, heart murmur, and pericarditis. What is angina pectoris? Angina pectoris is severe pain or discomfort in the center of the chest. It is also known as angina. So what causes angina? The arteries that carry oxygen-filled blood to the heart muscle, known as coronary arteries, become narrow as we age and the walls become irregular. These changes may allow buildup of fat, cholesterol, and blood clots to collect in the narrowed artery. If blood flow to a certain area of the heart decreases or even stops completely, the heart develops ischemia, or a deficiency of oxygenated blood, and you develop chest pain or angina. So what are the signs and symptoms of angina? People with angina may complain of chest pain discomfort, not necessarily chest pain. The description of this chest discomfort may include heaviness, squeezing, tightness, pressure, strangling, or burning. Pain is located in the middle part of the chest under the breastbone and may travel to the arms, shoulders, neck, or jaw. The discomfort or pain of angina usually lasts from 5 to 15 minutes and may be relieved with rest or medications called nitroglycerin. Pain lasting longer, more than 15 minutes, may indicate complete blockage of blood flow, resulting in a heart attack. So how to diagnose, or how is angina diagnosed? An electrical or ECG or EKG is performed to evaluate the heart muscle, and it may indicate ischemia or damage. Sometimes blood tests are needed to detect heart damage. An exercise stress test, sometimes referred to as treadmill test, is another method to evaluate the heart muscle. Sometimes a coronary angiogram is needed as well. This is a procedure where dye is used to visualize the heart vessels directly. Treatment. How is angina treated? The goal of therapy is to improve the quality of life, reduce symptoms, and prevent heart damage. Diets low in cholesterol, fat, and salt are very beneficial. Avoiding cigarettes can improve blood flow. Nitroglycerin should be carried by diagnosed patients at all times to administer if angina pain occurs, and the patient should seek emergent medical care if the pain is not relieved with 3 tablets in 15 minutes. An angina that is no longer relieved by rest or medication should be further evaluated. Heart failure. Heart failure results when the heart can no longer pump an adequate amount of blood to meet the needs of the body. The most common cause of heart failure in the United States is coronary artery disease. High blood pressure, disease of the heart valves and heart muscle, and congenital heart defects. Defects present at birth can also cause heart failure. All of this cause damage to the heart muscle, leading to decreased pumping action. What are the signs and symptoms of heart failure? The symptoms depend on which side of the heart is affected. In the left-sided heart failure, you may have a cough or shortness of breath when lying down. You may need to sleep on several pillows to help you breathe during the night. Shortness of breath can also occur with any activity, such as walking. Right-sided heart failure commonly causes swelling of the feet and abdomen. How is the heart failure diagnosed? The most common test is an echocardiogram, which is similar to an ultrasound. This exam evaluates how the heart is functioning. A chest X-ray and other blood tests may be ordered to detect heart damage. How is the heart failure treated? Certain medications can improve heart performance and decrease the amount of work the heart has to endure. Angiotensin converting enzyme inhibitors, beta blockers, and digoxin are common medications. Diuretics, or sometimes referred to as water pills, allow the body to eliminate excess amounts of fluid. And also, you can control blood pressure and cholesterol, stop using alcohol and tobacco, and also by losing weight. Endocarditis is the inflammation of the inner lining of the heart, and it is caused by bacteria that enter the bloodstream during certain surgical or dental procedures. Approximately 50% of the people who develop infected endocarditis have underlying heart condition. Symptoms of endocarditis include fatigue, fever, muscle aches, weight loss, and decreased appetite. Other findings include hemorrhages that are visible under the surface of the nails and skin. How is endocarditis diagnosed? Blood tests can identify the presence of microorganisms that cause infected endocarditis. Other blood tests, including a complete blood count, identify signs of infections or inflammation. An echocardiogram may be needed to visualize the heart further. What is the treatment of endocarditis? Treatment with antibiotics is needed immediately to reduce complications. These are initially given in the hospital because high doses are needed intravenously. Depending on the severity of the infection, treatment may be needed up to 6 weeks. Myocardial infarction, more commonly known as heart attack, is a major cause of death in the United States. A heart attack occurs when a coronary artery, the artery that supplies blood and oxygen to the heart muscles, becomes clogged. Without blood and oxygen, the heart muscle can become damaged and lose the ability to pump oxygenated blood to the rest of the body. What causes heart attacks? The arteries of the heart become narrower as we age, and the walls become irregular. These changes may allow a buildup of fat, cholesterol, and blood clots to collect in the narrowed artery. Other causes of heart attack include coronary artery spasm and cocaine use. What are the symptoms? Patient having heart attack usually has chest pain that is described as a heavy pressure squeezing sensation. The pain may travel to the arms, neck, or jaw. The longer the pain continues, the more damage is done to the heart. Some patients may also experience shortness of breath, anxiety, nausea, vomiting, fatigue, and increased sweating. Women, diabetics, and the elderly may not experience classic symptoms like chest pain, which is termed as a silent heart attack. Diagnosis. An electrocardiogram is performed immediately to evaluate heart muscle and detect if any damage has occurred. Sometimes blood tests such as cardiac enzymes are needed to detect damage. An exercise stress test, sometimes referred to as a treadmill test, is another way to evaluate heart attack. Coronary angiogram is needed as well. This is a procedure where dye is used to visualize the heart vessels directly. How is heart attack treated? Heart attack is a medical emergency, and early diagnosis and treatment are needed to maintain blood flow to the heart. So we needed oxygen, narcotics or pain medications, nitroglycerin, and aspirin are often used to decrease pain and improve blood flow. A coronary angiography is a procedure where dye is used to identify the coronary arteries. If narrowing or blockage is found, balloons, medications, lasers, or metallic stents may be utilized to restore blood flow to the heart muscle. If the blockage and damage are severe, a coronary artery bypass, graft, or CABG may be needed as well. Hypertension, or known as high blood pressure, is the most common cardiovascular disorder affecting 73.6 million Americans. Hypertension occurs when blood flows through the arteries under a higher pressure than normal. It is called the silent killer because there are often no early warning signs or symptoms until it reaches advanced stages. In most cases, hypertension has no known cause. When this is the case, medical professionals call it essential or primary hypertension. In a small number of people, hypertension is caused by kidney disorders. This is called secondary hypertension. Some of the risk factors for developing hypertension include obesity, tobacco and alcohol use, physical inactivity, and diets rich in fats and salt. How can you tell if you have a hypertension? So there may not be any noticeable symptoms or signs of hypertension. However, some patients may complain of headaches or nosebleeds. What are the diagnoses of hypertension? Blood pressure measurements. So if you have normal blood pressure less than 120/80 millimeters of mercury, pre-hypertension, that is 120/80 to 139/89 millimeters of mercury. Hypertension, this is already 140/90 millimeters of mercury or greater than that, then you have a hypertension. How is hypertension treated? The most important goal in managing hypertension is to control the blood pressure for prevention of damage to the eyes, heart, and kidneys. Controlling blood pressure also decreases the risk of stroke. You may be prescribed diuretics, beta blockers, calcium channel blockers, or angiotensin converting enzyme inhibitors to lower blood pressure. A murmur is an altered sound that usually develops from a damaged portion of the heart or heart valves. The four valves in the heart serve as gates to maintain a forward flow of blood. Damage of the valve can result in narrowing or leakage. Some murmurs may occur in individuals such as athletes and babies without underlying heart disease, and they are not harmful. What causes murmurs? Diseases such as rheumatic fever, endocarditis, or congenital cardiac defects that are present at birth can lead to heart valve damage. Murmurs can also be caused by conditions in the body that alter the function of the heart, such as anemia and pregnancy. How can you tell if you have a murmur? Many patients with murmurs have no symptoms, and the murmurs are found during routine physical exams. However, patients may experience fatigue, shortness of breath, palpitations, or rapid beating of the heart, fainting episodes, chest pain, or anxiety. Diagnosis, EKG or ECG. An echocardiogram may be needed to evaluate murmurs. An echocardiogram is similar to an ultrasound and allows visualization of the heart structures and valves. Treatment. The management of a murmur depends on the type and severity. Patients without symptoms may not need treatment at all. For severe murmurs that cause symptoms and have the potential to cause complications, medications or even surgical valve replacement may be needed Patients with certain murmurs may be at risk for endocarditis and will need antibiotics to prior undergoing surgical or dental procedures. Pericarditis refers to an inflammation of the membrane surrounding the heart, which is called pericardial sac. Pericardial sac holds the heart in place and protects the heart from surrounding infections within the chest cavity. The cause of pericarditis is usually unknown. However, certain viruses, bacteria, fungi, tumors, and autoimmune disorders have been known to trigger inflammation. How can you tell if you have a pericarditis? The most common symptoms is sharp chest pain that travels to the left shoulder and worsens with deep breaths or while lying down. The pain is relieved by sitting up and leaning forward. Fever, fatigue, and muscle aches may be present as well. How is pericarditis diagnosed? When pericarditis is suspected, an electrocardiogram may be needed to detect the diagnosis. A chest x-ray and blood test may be also ordered to help in the diagnosis. How is pericarditis treated? Bacterial causes of pericarditis are treated with antibiotics. Most viral infections are self-limited, with symptoms resolving in several days or weeks. Bed rest and anti-inflammatory medications are prescribed to reduce symptoms. Pericarditis can lead to cardiac tamponade. Fluid collects rapidly in the pericardial sac, which can result in pericardiocentesis. It's a procedure that removes fluid from the sac with a needle.